I'm Jane Bridges, back with Module 3. Let's talk about the benefits of exercise. Exercise really lowers blood sugars. In fact, it's one of the least underutilized therapeutic regimens that we have to offer patients. When patients exercise on a regular basis, their diabetes is under much better control. Exercise, or the effects of it, can last up to 24 hours in reducing blood sugars. It helps insulin work better. The patient is less resistant to insulin. It reduces weight and fat. It builds muscle strength and tone. And whenever you're more toned and your muscles are strong, you're less likely to fall, because patients with diabetes fall a lot because of being unbalanced from diabetic neuropathy. Exercise helps prevent heart disease. It improves circulation within the legs. It improves bone mass and bone density, especially when you're doing weight-bearing exercises like walking. And it helps reduce stress and helps with depression. And again, exercise is one of the least utilized therapeutic modalities for the management of depression and anxiety. So we strongly encourage you to find an exercise that you like and can enjoy because you will reap the benefits of that exercise. So what kind of exercise? It should include some flexibility training. That would be like yoga and Tai Chi, some strengthening that could be, light weights or just using your body weight to help strengthen muscles, and aerobic activity. Adults it's currently recommended, should engage in 150 minutes or more of aerobic activity over 3 to 5 days per week, with no more than 2 consecutive days without activity. So you might hear the cardiologist say you need to exercise 3 times a week. That's for cardiovascular fitness. But when we're using exercise as a therapeutic modality for the management of diabetes and high blood sugars, you really do need to exercise about 5 to 6 days per week to get those benefits. Don't let that discourage you. Do whatever you can, but understand that if you're using exercise to help control your blood sugars, you'll need to do it on a regular basis. Adults should engage in 2 to 3 sessions of resistance exercise. That would be like light weights. Flexibility and balance training are also very important, and you can get that in yoga and Tai Chi, especially for the elders who are at risk for falls. But do what you enjoy. You can even do armchair exercises if you're debilitated and your back and your knees won't allow you to do a lot of walking. Water exercises are incredibly important and helpful and very powerful in their ability to lower blood sugars. Always start slow and gradually increase. We don't focus on no pain, no gain kind of concepts. We don't want any injuries, because injuries will set you back and keep you from exercising. So go slow and take your time, especially if you've not exercised for a while. Exercise with friends if you can. It's a lot more fun. You can meet new friends that way. And then I want to talk about sitting, because we seem to do a lot of sitting. Interrupt prolonged sitting every 30 minutes with at least 3 minutes of light physical activity, moving, stretching, light walking. Now, the first 8 hours of sitting in your day are free, but after that, you need to start interrupting sitting and get more active for the next 8 hours. It's typically 8 hours of work, 8 hours of play, and 8 hours of sleep. So the 8 hours of play should be a bit more active if you can incorporate more activity and less sitting in your day. Let's talk about being safe and smart when you exercise. Most importantly, protect your feet with good socks and properly fitting shoes. If you're concerned about blisters, wear 2 pairs of socks to help reduce the occurrence of blisters. Always carry those glucose tabs that I just showed you a little bit ago. Have 4 of them in your pocket, just in case you might have a low along the way. It's important that you handle that low blood sugar quickly and not think that you can make it back to your home to receive a treatment there. Check your blood sugar before and after exercise and find out what you might learn and discover. Keep some logs and just track how exercise benefits you. Warm up if you can. Warm up can just be doing the activity a little slower, like walking slowly and then gradually increasing your speed and pace. Protect your skin with bug spray, sunscreen, wear a hat. And if you're going to Florida right now, like everybody seems to be doing, please don't burn your feet on the hot sand and sun, because burns to the feet can be incredibly devastating, especially for people who don't have good circulation coming down into their feet. Now, if you happen to need to exercise with friends, they're expecting you to come, but you've discovered that your blood sugar is low, what do? You will need to consume 40 grams of carbohydrate, whether glucose tabs, whether juice, whether a can of pop. You'll need to consume 40 grams to get that blood sugar up and allow you to exercise. So don't start exercising when your sugar is, let's say, below 100. It should be above 100 to get you safely through your exercise. Stay hydrated. Water or low carb, low calorie G2 or other sports drinks can be incredibly helpful in keeping yourself hydrated. Now, if you think you're going to have lows, then have a G2 or a sports drink that also has calories in them, so you can pick and choose what would work best for you while you're exercising. It's important, especially for patients with diabetes who are older, to prevent falls. Falls are so detrimental to my patients, and in fact become the turning point in whether the patient remains independent in the home or proceeds on into a nursing home. Generations offers a balance class. It's called a matter of balance. So if you ever see this or hear this on the radio, in the news, or any publications from Generations or through Good Samaritan Hospital, take advantage of this 8-week course that can help you improve upon your balance and help prevent falls. What if you're sick? What do? These are called sick day rules. Just because you don't have an appetite and you're sick doesn't necessarily mean you can stop all of your diabetes medicines, especially long-acting insulins. And if you have type 1 diabetes, you are not to stop your long-acting insulin. You must take it, because failure to take it could lead to diabetic ketoacidosis. Illness is a stress, so your blood sugars could go very high. So it doesn't make sense to not take your diabetes medicines when your blood sugars are climbing. If you find that your blood sugars are on the lower side, then by all means we may need to reduce insulin or hold a pill, but do so with the advice of your doctor. One medicine that I need to make you very aware of are the SGLT2 inhibitors, and that's Jardiance, Invokana, Farxiga, or Stiglatro. Let's say you're sick and not eating. Don't take those medicines. Or another example, your NPO, nothing by mouth, for a colonoscopy or a surgical procedure. Do not take those medicines. You need to be eating and well to take these medicines. Check your blood sugar often to make sure that you're staying on top of the high blood sugars as well as the potential of low blood sugars. If you're unable to check your blood sugars because you're so sick, call a family member in or a friend to help assist you. And if you're that sick, you may need to be talking to your healthcare provider. Always stay hydrated. You may need more fluids with carbohydrates, and then those other fluids that don't have calories in them. Let your blood sugar guide what kind of hydration you need, whether it's calories or no calories. And again, if you have type 1 diabetes, don't skip your insulin shots, and you may need to be checking your ketones in your urine with every void. Call your healthcare provider, and if I'm that person, you call me if you see moderate to high ketones. Again, you may be going into diabetic ketoacidosis, and I may need to help you with that, and hopefully keep you out of the hospital. So when should you call your doctor? If you're vomiting and can't keep fluids or medications down. If your illness lasts longer than 24 hours with no sign of improvement. If you have type 1 diabetes and have moderate to high ketones, again, I can't emphasize this enough, take your insulin, don't skip it. Blood sugars that are found to be consistently greater than 250, you need to call us. I need to help you further. Call for guidance and help with any other questions you might have. Again, use your finger and that phone. You all have them. Call. Ask us for help if you need it. And what's our number? For those patients who are my patients, we give you insulin cards like this. Turn the card over. It's amazing how people forget to look at the back of this card. Our emergency numbers are right there. Our office numbers are right there. Please call us if you need our help. Okay, now I want to talk a little bit about coronavirus or COVID-19. If you've not been vaccinated yet and are not planning on vaccinating, it's really important that you follow what I call the 4D approach. Distance, 6 feet or more. Duration of being around other people, less than 15 minutes. Want to prevent droplets from entering your body, so wear a mask. And disinfect as much as possible. But more importantly, get vaccinated as soon as possible. We've opened up vaccinations to people in the state of Indiana. There's no reason for you not to be vaccinated. I highly recommend it. I think it's important for you in regards to your health, as well as getting your freedom back and hopefully helping to reduce paranoia and fear. So I can't say enough the importance of getting vaccinated against COVID-19.